All right, hello everybody. Welcome to the hybrid session on adapting locally led peace building in uncertain times. This session's an interactive online and in-person session that's going to combine a presentation of research findings, stories of practitioner experiences, and a mini workshop to help gather some lessons on how we as a community of peacebuilding practitioners adapted our participatory, locally led programming during COVID-19, and how these lessons can help us to respond to future crises and shocks of any kind in more inclusive, resilient, intentional ways. I'm Ryan Shealy. I'm the Director of Research in Conflict and Governance at Mercy Corps, and I'm our facilitator and moderator today. Before we start, I want to mention a few technical details. As I mentioned, this is a hybrid session, I think really appropriately for a session on adaptations during the COVID era. In our room here in DC, we'll be listening to the English channel throughout the duration of our presentation. If you're online and you wish to listen in English, please select the English language channel in Zoom, and you'll hear the original presentations for most of the panel and the voices of our interpreters when our panelist Amal speaks. If you wish to listen in Arabic, select the Arabic channel, and you'll hear the interpreters during most of the panel, and we'll hear Amal while she presents. For online participants, our Mercy Corps colleague Britt Sloan is leading our online facilitation, so do put any technical questions in the group chat or direct Zoom message to her, and she'll help route you towards AFP volunteers as well. Next slide, please, Britt. So as I mentioned, we have four main parts of our session today. So up next, my colleague Bharati Radhakrishnan will present some preliminary research findings from a project that is looking back at how Mercy Corps programs and partners adapted participatory programs during COVID-19. After that, we'll feature presentations from two local Mercy Corps partners in Iraq and Nigeria, and I'll introduce them more before they speak. And then the last 20 minutes of our session or show, we'll actually do breakout groups to help brainstorm resources, tools, and other ways to help translate these research findings into action and adaptation in future crises. So without any further ado, I'm going to introduce my colleague Bharati. Bharati is the researcher for peace, conflict, and governance here at Mercy Corps. Her work focuses on applying a gender lens and analysis to peace building and governance programs and research. Bharati.
Hi, everyone. Can you hear me okay? Great, thanks, Ryan. So as Ryan mentioned, I'm going to talk about the PACE project. So PACE stands for Participatory Adaptations during the COVID-19 era. What I'm going to do is give a brief overview of the study, the methods for the study, the preliminary findings at this point, and some future considerations for program adaptations. Next slide, please. So for the study overview, we had two main objectives for our study. So we first wanted to systematically learn from program-driven adaptations taken by our Mercy Corps colleagues worldwide. And we wanted to know what adaptations they were taken, particularly during COVID. Now, while the study is focused on the COVID context, we want to develop learning products and tools that will be useful for all types of shocks in the future, not just public health shocks. So the research question that was guiding our study is, what can we learn from adaptations taken by Mercy Corps participatory programs during COVID to prepare for future shocks that reduce access and the ability to have the face-to-face interaction, which is critical for participatory programs. Next slide, please. So the methods for our study, this was a purely qualitative study. And what we first had to do was select which Mercy Corps programs we wanted to focus on. So our selection criteria focused very much on if the program was participatory in nature, and then we also wanted the program to be functioning within a certain time frame. So looking with those two criteria in mind, we did a thorough document review of all of our programs, and then we did screening interviews with program staff, which further refined our list. And eventually we selected 15 Mercy Corps programs over 10 countries. And with those programs, we did key informant interviews with at least 2 people from each program, either at an implementer level or at a more managerial level. So those key informant interviews were the basis of our findings. And I think it's important to emphasize that this study is actually still ongoing. While data collection is done, we did our first round of coding, and we're going to be doing our second very soon. So what I'm going to be sharing with you are just preliminary findings. Next slide, please. So when talking with our colleagues, there were 4 main groups of program adaptations that we learned about. So the first one is digital adaptations. So this very much refers to remote participation through WhatsApp or conference calls or Facebook. The second main category was restructuring activities. So instead of having meetings together, there might be door-to-door consultations. Instead of having meetings inside, they might have them outside instead. The third main category is shifted program topics to address new needs that arose because of COVID. So for example, some programs might include the distribution of PPE kits, or they might incorporate hygiene awareness within their programming. And then the fourth main area was community engagement. So a lot of these adaptations heavily relied on community mobilizers and committee members taking more of a facilitation role. Next slide, please. So looking at these program adaptations and the other data from our interviews, we came to 4 main preliminary findings, and I'll go through each one right now. Next slide, please. So the first finding is that digital adaptations can encourage more inclusion. So for example, if there are people who cannot physically travel to programs or activities, they can participate remotely. So people living with disabilities, this could be very accommodating for their situations. Additionally, in many of the contexts that we were conducting our programs, youth tend to have a better digital literacy than other parts of the population. So in that sense, youth had more opportunities to take a leadership role in these programs. And lastly, with some adaptations, we learned about unexpected participants and unexpected results, particularly in one of our programs in Haiti. There was a livelihood training program for youth, but with COVID, they adapted this program to be done through conference calls. And through that, when the youth were calling in from their homes, their parents would also listen in. So they were also learning about all of these skills in this training, even though they weren't the intended target audience. So it's a really great positive result that was not expected. Next slide, please. So the second finding is that participatory adaptations can have gendered implications. So particularly with digital adaptations, it might make it easier for certain members of the population to circumvent gender norms that might make it difficult for them to travel to participate in programs. Like, for example, if women are the primary caretakers in the home, they can still participate in these activities if they're able to call in or join online. Additionally, another program adaptation that we learned about was that instead of having larger group meetings or activities, the meeting sizes were reduced. And in these smaller group settings, women felt more comfortable speaking up and participating more willingly. Next slide, please. So the third main finding is that relationships and trust are key enablers for these adaptations. So these existing relationships that we had with authorities and with community members, it was a really helpful way for us to be able to adapt our programs because these had relationships that helped us with these changes. Additionally, trust in local community members to lead the adaptation process was also very important. And related to that, because of that trust, we were able to delegate a lot of the program activities and responsibilities to people living within the communities, because access wouldn't be an issue for those people because they'd already be there. So having that relationship and trust with them made this delegation process really fruitful. Next slide, please. And the last main theme is that community voices need to inform adaptations, particularly in layered crisis situations. So a number of our programs were being implemented in contexts where COVID was not the only crisis. So in the DRC, Ebola was a big challenge as well. In Afghanistan, it was also the Taliban. So in those contexts where there's so many competing shocks to deal with, listening to the community and their suggestions for adaptations is critically important. So avoiding that top-down approach with adaptations. Next slide. So I'll end here with considerations for future adaptations that our colleagues discussed with us. So one is the importance of investing in digital literacy, not just for our staff, but also for our program participants. Second is to think about the needs of vulnerable populations when you are adapting programs and making sure that it's not excluding these populations. And lastly, plans for program adaptations need to be context specific.
Our next speaker is going to be one of our online panelists, is Ms. Amal Ghazi Jassim, who is the Vice President of the Justice Organization for Minority Rights and the head of the Women's Advisory Council in Nineveh Government in Iraq. Amal.
السلام عليكم. أمل من العراق نائبة منظمة العدالة لحقوق الأقليات.
I am Amal from Iraq, and I'm the Vice President of Justice Organization for Minority Rights and the head of the Women Advice Council in Nineveh, Iraq. I will give some examples about our field group in our committee of the Field Consultation Network in Nineveh. The violence, the domestic violence against families, especially from males, and because of the staying homes during the epidemic of COVID, because of everyone is sitting at home, and we intervened through our consultant committee, field consultants, and we went to visit to our the homes, and was taking all kinds of caution, especially in the tribal area, in the villages. And this is the first intervention that we took through our committee. And it was initiative of distribution in Nineveh and some of the villages with cooperation. We cooperated with the health department, and they supplied us with list of names and addresses to help us providing assistance to them. And we had sessions outside of homes when we did not go inside their homes. And also we offered these sessions through our social media pages and through also the TV. And we met also with managers of the health departments and the health centers whom were entitled to give information about how to deal with the epidemic of corona.
Next slide. طبعا هاي بعض الصور عن جائحة كورونا.
These are some photos about the epidemic of corona and the vaccines that we were notifying the public, and we were putting them everywhere in the stores and the governmental places.
الدعم الصحي لمركز احتجاز النساء في النينوى. طبعا هذا
Health support to women's detention center in Ninawa.
بعد الاطلاع على المعاناة التي تواجهها السجينات أو المودعات في قسم التسفيرات أو في مركز شرطة في نينوى.
After understanding all the obstacles and the troubles that the detainee were facing, the female detainee were facing,
أطفالهم دون السن الثانية السنتين,
with their children who are under 2 years old, and they lack the health care, appropriate health care. We coordinated with the authorities to get the approvals to enter the prison, especially the women's section.
القاعة بالتنسيق مع مديرية الدفاع المدني على مدى 3 أيام. وبعد ذلك قمنا بشراء وتوفير المواد الصحية اللازمة له.
We were able to buy all the health materials necessary for them,
داخل السجن.
and we were distributing it to the beneficiaries inside the prison up to the age of 50 years old in all the governorates in Iraq, including Anbar, Salahuddin, and Ninawa governorates, and we were cooperating with the health department in Nineveh, and we were providing all health care necessary materials, because there the female prisoners were subject to all kinds of health problems, and we discovered that there was a need to provide psychological health care through establishment of a healthcare unit inside the prison to provide the healthcare and the psychological healthcare.
بريت متى يظهر السلايدات يمي؟
Brett, when the slide will show up in front of me.
اوكي. أما السلايد الأخير.
Now it is the last slide. There were a lot of challenges that we faced.
منها
Some of them are: first is a difficulty in mobilization, movement, and access during Corona, difficulty in obtaining approvals, official approvals, and some of troubles in cooperation from decision makers and officials. Also, the digital literacy of the softwares and apps that were used during the epidemic of COVID, and funding problems and interference from other parties, especially during field work.
طبعا هذا السلايد الأخير هو
This
الفريق
is the
الذي
last
قام
slide. This is
بتأثير
our
بعض الدوائر
team
المعنية كالمدارس والاتحادات والنقابات.
that we use to fogging
Thank you very much.
the clubs and other places where a lot of people are present, like in prison and others.
Thank you so much, Amal. Our next presenter is Dawara Yunana Dawara, who is the program manager for Women in New Nigeria, which is a Nigerian nonprofit organization founded in 2010 that focuses on the empowerment of women and youth in Nigeria. Dawara's portfolio includes peacebuilding, protection, reintegration, mental health, and psychosocial support, and disability inclusion programming across Borno State in Northeast Nigeria. Dawara?
Thank you so much, Rian. I'm thrilled to be given this opportunity to talk about my experience in Nigeria during COVID adoption. Thank you. Brit, next slide. Hello, Brit, can you hear me? Next slide. Yes. So in the context here in Nigeria, I'll be specifically speaking to our context here in the Northeast, specifically Borno State, Nigeria. During this COVID pandemic, Borno State, Nigeria have suffered a decade-long humanitarian crisis from Boko Haram, and also and this has also led to so many issues that the community have been suffering from. And again, part of what was prevalent during the COVID pandemic was the first index case that was identified in my country was also identified on a humanitarian aid worker who happened to be MSF staff. And this particularly is one of the communities that we also implement. And this has also led to misconception and stigma against humanitarian aid workers. Humanitarian aid workers were seen whenever they are coming to the communities as if they are the ones bringing COVID and so many other issues. Then this has also led to instance of participants or community members going to MSF clinics to attend to their services or to have the services that are being provided in the clinic, because they are seeing that if they go there, they may contract COVID from MSF staff. Then as a result of that, again, as a result of COVID, there was also a prevalence or increase of domestic violence and mental health challenges in the community, because everybody was at home and so many issues of domestic violence were reported. And with the emergence of COVID again, there were also effects of the COVID policies have affected the income of daily laborers, because some people that usually depend on their daily work, let's take it for instance, a woman that fries akara, we call it in our local dialect, that they usually have that and do it and get their money that day and also spend their day on it. So because of that, so many of them couldn't come back or couldn't have that their business. So as a result, as a result of COVID, this has hampered a lot of businesses and also a lot of movement and restrictions. Thank you, Brit. Next slide. I'll be talking specifically to our program, one of the programs we've implemented with Mexico, titled Northeast Conflict Management and Stabilization Program. Prior to COVID pandemic, we have some set of committees that were well established and trained in communities. This include Good Governance Committee, which that was responsible for conducting advocacy initiatives, and also a Conflict Management Committee. This committee were responsible for conducting community dialogues. And then we have psychosocial support groups, these subcommittees were responsible for issues regarding trauma resilience. And we also had 2 committees that are responsible for women and also youth, which that is Youth Support Network and also Women Council. So these committees structures helped us in implementing our activities while staffs were unable to access their communities. Next slide. As you can see in this picture, you can see members of Good Governance Committee developing their action plans. So for us, the first step we took during the emergence of COVID-19 was for us to sit down as a project with support from Mexico and also the local partners to sit down and develop a business continuity plan. And part of our agreement was for us to allow to cascade the implementation to the community-based structures and also community mobilizers who are residents in the communities. So we have key agreement that were also put in that business continuity plan. One of the things that we've agreed to do was for us to integrate COVID messages into our own activities and also to reduce number of participants because the government has given out a rule that we are restricted to a certain number of participants, and even from our end, we also looked at it and we have to reduce it to 15 because the government was saying not more than 30 or 15, but or 50. From our end, we decided to cluster them at least into not more than 15. And for dialogues in a bigger hall, we make it to be 30. So, and also we've also decided that we should stop all local government travels, inter-LGA travels, both for staff and also for program participants, because the program was designed in such a way that program participants do travel to Maiduguri for trainings and other activities, and also program staffs do visit our field. And we also decided that we're going to have a remote participation in meetings because we understood that coming together may affect because of the restrictions, movement restrictions, and also lockdown. So we decided to resort to remote participation in meetings and also remote support to our local community-based volunteers and also community structures. And also this has also affected our budgeting. So we decided to also realign our budgets to adopt the new realities. Thank you so much. Britt, next slide. Part of what we've agreed, part of our adoption was for us to cascade the information or allow the community participants to be the facilitators while we as local partners facilitate support through online platforms, sometimes using WhatsApp groups, sometimes using Zoom, and sometimes using Facebook, and sometimes using Messenger. So, and this has been between us, between the local partners. Mexico, we send it to us as local partners, then we, the local partners, cascade the information to community-based structures. But as when we're implementing these activities, there were some issues and challenges that we've identified at that time, which is one of them is network issues. Because of network issues, sometimes reaching out to community members was very challenging, and it was somehow delaying in getting response from program participants. And part of the agreement we had was for us to give program participants a token, little token, so that they can recharge their phones and also call us whenever there's need, and also for them to have data. So the expectation was high from program participants, so they expected much more than we're giving them. And also one of the challenge again, we have other community members who are very good and who have those leadership skills, but then they lack access to smartphones. So as a result, some of the community participants have to sell their local assets, just to purchase a smartphone, so that they'll be recognized and so that we can send messages. And another challenge was some of the participants that were illiterate felt being excluded because most of everything was being sent through WhatsApp platform, and there's no, you have to read before you understand what is there in the paper, because usually when we go to the community, we speak to them and we have the facilitations with them. But during the COVID, we have to send, we don't have any alternative rather than to send to their group head and share this thing with them. So as a result, some felt excluded because they are feeling, why is it not being shared with us? So this is one of the challenge that was also pertinent during that time. Brit, go ahead. Next slide. Okay, yeah, another thing was for us to shift in topics. We've changed because COVID has come and everything have changed. So our topics too have changed. We have different activities that we have town hall, we have cultural activities, we have different kind of social cohesion activities that allows community members to gather together to do so many activities. As a result of COVID, we have to change these activities to adapt to the new context. And again, part of the adaptation, one of the things that our Good Governance Committee were able to do was for them to conduct advocacy, and of which it was very loud in the community, and community was so proud of the activity that they did. They conducted an advocacy to the government stakeholders and also the stakeholders who are responsible for distributing food palliatives regarding support for persons with disabilities, so that they can have a home delivery of the palliatives, because when they are doing the distributions, some of them may not be able to join queue. And also for women, again, especially who are pregnant, it was also challenging for them to join queue to get palliatives. So as a result, they have to, Good Governance Committee have to organize themselves, go to the local government officials and also to the local community-based NGOs who are still in the community to conduct advocacies to them, and of which these palliatives were also given. And another thing is that youth, there was also challenge and a conflict between the youth and also traditional leaders and also other stakeholders in the community as a result of equal distribution of palliatives. It was observed that in some of the communities, some traditional leaders or some of the stakeholders decided to give to few to people that they prefer, that they want to give the palliative to, other than giving to everybody. So as a result, our conflict management committee were able to organize a community dialogue session, of which they were able to resolve and also come to having a good action point, and they're able to resolve that. And other challenges that we've also encountered was some of the religious leaders, because of religious belief, some of them could not believe on COVID. So because as a result of that, they were feeling somehow because we talk to our committees that they should talk to their subjects, so that during their worship hours, they should preach to them about COVID. They should understand that this COVID can contract anyone and can affect everybody. So as a result, sometimes some of the religious leaders felt that the COVID has maybe emanated from somewhere that they are not really sure of, and they misinformation with COVID narratives, which has prevented health adherence to health protocols, and also conflicts among stakeholders on palliatives. So I think I've talked about this point. We can move down to the next slide. Great. So these are the samples of hand sanitizers, face masks, and that was delivered to communities so that they can be using it during their activities. And also, these are a group of youth that have helped in having new water reticulations in their community, because they felt, okay, they can also support their community during this pandemic period. For us, we supported in making the procurements, while the community's youth, themselves are supported in doing the activities themselves. So yeah, next slide, Rich. So, and this is also one of the during our PhDs also tried to show people how they can also wash their hands, trying to do icebreaker and so many other things, so that community members will understand how COVID affects them. Next slide. So this is these are community members trying to practice hand washing. This is particularly in one of the communities in Goza called Pulka community. So next slide. Thank you so much for listening. Nagode. That means thank you in my dialect. Thank you so much. Bye-bye.
Thank you so much, Dewar, and I'm glad I got to unmute so that you could hear some of the large round of applause that you got here in the room in DC. So what we're doing next, we decided that just a hybrid panel is not difficult enough, and we are doing breakout groups. And so here's how it's going to work. So the purpose of this next session is to reflect on these research findings that Bharati shared, as well as Amal and Dewar's experiences as smaller groups. And what we're going to do in these small groups is do some brainstorming about what types of tools or resources could help practitioners draw on these lessons more effectively in future crises. And again, this could be any kind of shock that reduces access, not just a public health emergency. So what we'll be doing is breaking into 3 groups to do a design wall with sticky notes. For our online group in Zoom, they will all stay in one Zoom room and use virtual sticky notes in Google Slides. Britt will be sharing that and putting that up. And the adaptation that the Zoom group will be focusing on is digital adaptations, and especially virtual sessions. For our participants here in DC, we can self-sort into 2 groups. One will be focused on facilitation by local actors. That will be in this corner of the room. I'll be facilitating that session. The other group will focus on brainstorming tools to help with adaptation of topics of programs. So these types of shifts of taking a peace building program and adapting to a new emerging crisis. That will be on this corner of the room, and Bharati will be facilitating that. We have lots of sticky notes, some pens, but if you have a pen, bring your own pen, and we will reconvene about 20 minutes to share out some of our lessons. So thank you very much in advance for your active participation. We can get to stand up, energize, and interact together. Thanks so much.